Hey, it's Jael from Cell-Based Nutrition. Let's talk about prostate cancer. Prostate cancer doesn't just affect the body, it impacts families, relationships, and the future. Yet too many black men are living unaware of their potential diagnosis or are too afraid to get checked. Black men are more likely to be diagnosed with aggressive prostate cancer at younger ages, yet many are too afraid to step forward for testing due to stigma and fear. In this video, I'll cover the early warning signs, the reasons why we should push back against stigma, ways in which men can act preventatively against prostate cancer, and encouragement for the men in our lives to get tested. Let's cut to the chase. Black men are disproportionately affected by prostate cancer, with earlier presentation, more aggressive disease progression, and higher mortality rates compared to their white counterparts. Furthermore, black men have less access to a wide variety of treatments and experience significant delays between diagnosis and actually receiving treatment. Racial disparities observed amongst black men with prostate cancer are multifaceted, and a lot stem from institutionalized racism. Cultural factors also play a role, with some mistrust of the medical system, poor client-doctor relations, a lack of information about prostate cancer and the treatment options available, fear of a prostate cancer diagnosis, and of course, perceived cultural stigma. So, where is the prostate and how does prostate cancer come about? So the prostate is a small walnut-sized gland in the male reproductive system. It is found underneath the bladder, in front of the rectum, and it wraps itself around the urethra. And its purpose is to produce fluid for semen. Prostate cancer occurs when cancer cells multiply rapidly in the region. When the cells in the prostate grow uncontrollably, they can turn cancerous. The risk factors for this is age, genetic risks, and of course, race. 1 in 4 black men will get prostate cancer, and that is double the risk of men in other racial groups. Men over 45 are more likely to be at risk, as are men whose brother or father have had prostate cancer or whose mother or sisters have had breast cancer. Black men can get prostate cancer at younger ages than other men from other racial groups. Usually it's men between the ages of 50 to 60, but with black men, unfortunately, we are seeing prostate cancer diagnoses from the age of 45. It is uncommon to have prostate cancer under the age of 45, but if you have the risk factors, so you have a family history of prostate cancer or a female family history of breast cancer, then your risks, unfortunately, have increased. Many men with prostate cancer don't have any symptoms, especially in its early stages. Many prostate cancers start in the outside or the periphery of the prostate, which means that the prostate wouldn't have enlarged or developed any growths to start pressing against the urethra. So the fact that it is symptomless in a lot of cases makes it more dangerous, because by the time there are symptoms, the cancer is likely to be more advanced. Symptoms usually present themselves when the cancer is formed close to the urethra. It presses against it, and then you'll start to see changes in your urination patterns. And this is really important. If you fail to urinate to completion, if your urine starts to come out in fits and starts, if there is dribble, if you notice that you are waking up during the night to urinate, that's called nocturia. If you're waking up in the night frequently to urinate, if you are urinating more frequently during the day than you usually do, then it would be in your best interest to go and speak to your GP about that, because those are the telltale signs that there could be a reproductive cancer taking hold. Some men have a fear of diagnosis of prostate cancer for what they perceive it means for their manhood. And I say manhood in inverted commas because an illness, a disease, a cancer doesn't have any impact on a person's gender or gender presentation. I also wouldn't be being honest if I didn't discuss the way that cultural homophobia plays a big role in why a lot of black men don't want to discuss prostate cancer or go to the doctor to get it checked. As I said earlier in the video, your prostate is within your reproductive system. So it's underneath your bladder and in front of the rectum. So the only way for a medical professional to be able to see, or should I say feel, whether your prostate has enlarged, whether it's abnormally shaped or positioned, is by a digital rectal examination, which is where a gloved, sterilized, lubricated finger is inserted into the rectum so that the prostate can be examined. And I have heard far too many clips and videos and overheard conversations of men who say that they would rather not present themselves to their doctor because of the fear of what that medical procedure could mean for their sexuality or for their manhood. And I almost don't have the words for how dangerous that rhetoric is and how it is responsible for the number of black men who only discover that they have prostate cancer when it has advanced or when it has metastasized and spread outside of the prostate to other organs and other regions. If you have symptoms, so if you notice abnormalities with your urine, if there is pain on urination, then a DRE, a digital rectal examination, can help your doctor very quickly find out if there are any abnormalities to your prostate. And then they can make an immediate referral to a secondary service at a hospital for you to undergo further examinations or, if necessary, a biopsy of the prostate to see if the growths contain cancer. Now, of course, I understand how traumatic any invasive medical procedure can be. And of course, there will be fears and worries and concerns. But this is why it is important for men to begin to talk to each other, because you may be surprised that there is somebody in your social network who has undergone diagnosis and perhaps treatment for prostate cancer, who will be able to talk you through the process, and knowledge helps to alleviate fear. Now, there is also a blood test that can be used to detect if you have abnormal prostate activity. It's called a PSA test, prostate specific antigen. And you take some blood and they look specifically for this antigen in the blood, and if it has elevated rates, then they will do further diagnostic testing to see if indeed you do have prostate cancer. However, in the early stages of prostate cancer, your PSA levels could still read normal. So a PSA isn't the only or the most foolproof way of detecting prostate cancer. So you may have an abnormally sized prostate, but your PSA levels are reading low or normal. And so a DRE, or digital rectal exam, could be needed to double, triple check to make sure that you don't have a prostate cancer, especially if you have a family history, you're over the age of 45, and you are of African or Caribbean descent. So a PSA isn't a way out of having an internal exam, because you have to bear in mind that it doesn't always demonstrate if there is cancer present, especially if you have symptoms. So if you have symptoms, if you're feeling that something's not right, you go for a PSA, but the PSA is showing normal, I would recommend, I would advocate, I would in fact plead, if I have to, that you go for a secondary test just to ensure that there aren't any abnormalities that the doctor would be able to pick up with a very simple, very straightforward, very quick internal exam. Early detection saves lives, and far too many black men find out that they have prostate cancer far too late. Over time, symptoms are ignored, calls or appointments to the doctor are not made, tests are not done, and the mortality rates of black men are significantly higher than those of men from other races because of some of these factors. If you do have prostate cancer and it's detected early, treatment can be swift and it has the potential to push that cancer into remission and to save lives. Now, it wouldn't be a cell-based nutrition video if I didn't discuss with you how lifestyle, food, and stress management all can help as preventative methods for cancer. An anti-inflammatory diet, one low in red meat, one low in dairy, and one low in processed food and sugar, is protective. Increased activity levels and exercise are great for driving down inflammation, boosting the immune system. Chronic stress drives and raises inflammation and it also drives down our body's ability to do effective immune surveillance. But chronic stress weakens these protective systems that our body has to search out and to destroy cancer cells. And so it's really important to look at health and wellness holistically as a preventative tool for serious and chronic illnesses and diseases. Your health is your legacy. Encourage each other as Black men to seek medical attention. Normalise checkups, normalise going to the doctor, normalise discussing symptoms, normalise being in touch with your body and realising when things have changed. Support each other, talk to each other, comfort each other. Cry down those who make it difficult for men to want to speak out about prostate cancer. Encourage your fathers, your brothers, your uncles, your sons to go and get their prostate checked. If you are over the age of 45, at the bare minimum, go and ask for a PSA test from your GP. If you are observing any changes to your urine, any pain on urination, then please immediately make an appointment to see your GP. Share this video to Black men who need to hear this message, because awareness saves lives, but taking action, that's what changes lives. I'm Jael from Cell Based Nutrition, and I'll see you in the next video.